Hey there, this is Michael with LP Health Directions, and today I want to cover the ZOLL AED 3. This is the AED device that's found at your site. Now you may have one or multiple devices at your site, so it's important to know where these devices are. Your device should be grabbed for any medical emergency and only used if the person is non-responsive, not breathing, or experiencing signs of agonal gasping. Okay, quick review on how to use your ZOLL AED 3. Step 1, turn it on. The power button is on the top left of your machine. As soon as you turn your device on, the machine's voice prompts will direct you on what to do next.
Automatic defibrillator. Stay calm.
The pad pack will be found on the back side of your AED device. You're just going to pull these tabs apart and take out the pads that are located inside. Step 2, before placing pads on the person's chest, remove clothing. You can use the trauma shears that are connected to your pad pack. Step 3, once you remove the pads from the pad pack, you're going to place the pads on the person's chest in the location indicated. Remove one pad at a time from the liner and place it directly on the person's chest.
Remove pad package. The patient's bare chest.
The ZOLL AED 3 has two sets of pads. One pad has a sensor that's placed in the middle of the person's breastbone. The sensor will detect your compression depth and rate during CPR, providing feedback. Once the pads are on, the machine will start to analyze the person's heart rhythm, and from this point on, you're going to follow the voice prompts. Do exactly what it tells you to do. For children under 55 pounds or under the age of 8, press the child button on the front of the AED and use the same pads. Follow the illustrations printed on the pads and place them in the corresponding spot. The pad with the sensor is placed in the middle of the child's chest, and the sensor is then placed on top of that pad. The second pad is placed in the middle of the child's back. Make sure the child is placed on a dry surface and that the chest and back are dry. If the person's heart is in a correctable rhythm, the machine will power up the shock. Depending on the model that you have, your device may ask you to press a shock button to shock the victim, or the machine will shock on its own. Just make sure you follow the voice prompts and do exactly what it tells you to do.
Don't touch patient. Analyzing.
Everyone stand clear?
Shock advised. Don't touch patient. Shock will be delivered in 3, 2, 1. Shock delivered. Start CPR. Push.
Your machine provides a metronome set at 100 beats per minute. If you're performing CPR after a shock, or if there's no shock advised,
Continue CPR.
provide compressions at this rate. Your ZOLL AED 3 will analyze every 2 minutes. Thank you for watching this video. My name is Michael. Don't forget to remain healthy and safe.